Hey, it's Phil.
Hello, it's Jeremy.
So we're back again to do a quick video on this piece of equipment here. So this is our extracorporeal shockwave machine. Now, that's quite a mouthful, but it's a machine we use all the time, most days. 3 or 4 times a day we'll be using this machine on someone. Now, what's the main condition that you would say we use this for, Jeremy?
Plantar Fasciitis.
Plantar Fasciitis. Yep. Okay, so you see a bit of that, do you?
A bit.
A bit.
Yeah.
Most of our pods will see at least 2 or 3 cases. I mean, a max I've probably seen is 7 or 8 cases in one day on a really busy day. But we see plantar fasciitis all the time. So plantar fasciitis. So what is plantar fasciitis, Jeremy?
So it can be an overuse of like connective tissue, which is the fascia.
Yeah.
And there's that fascia that's located beneath your foot.
Well, we have one we prepared earlier.
Oh,
so let's So here's a foot. How convenient. So here is a foot. This is my foot. So, so what's the green and the black areas there?
Yeah. So we drew that demonstrating kind of the 2 areas where a lot of people get the pain.
Here we go. Foot's back again.
Yeah. So the green part there, that's kind of a location at the heel bone, the calcaneus. There's a little bony prominent called the medial tubercle. And a lot of people, first step in the morning, they kind of get that pain at that location.
Yeah.
It's pretty common for that heel pain to occur in that specific location.
They're the people who, when they get out of bed, they say, I feel like an old man, I'm an old lady, I'm hobbling for the first minute or 2. So we're not diagnosing it over the internet, but you've probably got plantar fasciitis, insertional enthesopathy. Yeah. And what's this other bit at the front here? What would you say that is?
The black line?
Yeah.
Yeah, so that black line, obviously the fascia goes from the heel, connects to pretty much the ball of your foot. So that's the medial band. So the band that's closest to the midline of your body.
Yeah.
So some people get pain along there as well.
Yeah.
Could be just there or combination of that green circle and that black spot.
Some people get everything.
Yeah.
That's not fun. You don't want that.
No.
If you're getting pain in the arch, so if I use my foot again, in the arch through this area, it's often, I find it's often people, the more they do, the worse it gets. So they might have a big day standing on their feet. It gets worse through the day at work, or it gets worse. They play a game of footy and they have to come off because it's hurting, or it hurts really bad afterwards. It's like a sort of burning, tearing sensation. Yeah. But it's all the plantar fascia. Hey, it's all relating to that single piece of anatomy.
Yeah.
We have different treatment options that we use for this. So we use orthotics a lot. I definitely start off, we use taping, certain exercises to help strengthen and rehab the tissues. But this machine here is something we use, I'd say probably 3 or 4 out of every 10 people, 40% of the time, I would use this machine for a case of plantar fasciitis. Not often at the start, like it's not the first thing I'd use, but it's definitely a treatment. When you use this machine, Jeremy, when do you find it's appropriate to add this into the treatment plan?
Well, everyone's different, but if I was to talk generally, once the patient, we've kind of addressed what's causing the pain, whether it's bad shoes that aren't supporting the foot, or if they're just training too hard. Once we kind of establish, once we get a reduction of all that stress going to that plantar fascia, we can kind of use this as a boost to sort of speed up that repair process in the fascia.
So it's a part of a bigger plan. Because I know for sure, used on its own, I mean, there's people it's not good for. So if you've just got today you woke up, your heel pain's really bad, we would never use it on your foot, because that's a sudden, that's an example of we totally wouldn't. But like Jeremy's saying, if you've had this problem for a while and we've addressed all the other issues, it's almost like it kickstarts the healing process in that area. And it's just about, instead of it taking 3-4 months to get better, we want it to take 3 to 4 weeks. It's a really cool addition. So instead of explaining how it works, we thought we'd just do a really quick demo on my foot. Again, I'm offering my foot to science today to for everyone's benefit. So the question people ask is, does it hurt? And for some people it does. I mean, you have patients, Jeremy, who found it a bit uncomfortable.
Yeah.
What do you do if they're finding it a bit uncomfortable in that first session?
So usually I'll start with something, a bit mild. It is adjustable. So there are certain parameters on this machine which you can dial down, dial up, to suit the individual.
It's not particularly painful, but if you've had acute pain in an area and you're having that sort of a hypersensitivity in that area, it can be a little bit uncomfortable, but we can dial it right down. So don't be afraid if you have pain in this area. We're not going to torture you, we promise. It's a really good way to kickstart that healing process. So, all right, well let's do it. I'll move this camera up, and Jeremy will do a quick demo. So it's quite noisy. Sounds like a little mini jackhammer. That's what a patient described it to me as. And essentially that's probably a good way to explain what it does. It blasts apart the tissue using a high amplitude acoustic pulse. So it's not like ultrasound, it's not like just a very mild treatment. It actually is creating a cellular response in the tissue. All right.
So I think, Phil, you had kind of pain in that area?
Yeah, I actually did. I went through a bit of a run and strained it. So I actually do have a little bit of pain at the insertion and just a bit distal along the plantar fascia. So this is a proper test. That's a little bit twingy. I'd probably give that a 1 out of 10. But there is an area there where I can actually feel that the tissue is sensitive, and that's where the inflammation is in the tissue, or the disorientation in the fibres because of that injury there. But within the 20-30 seconds, that pain is hugely reduced. That's one of the cool things. Hopefully you can hear what I'm saying, but that's one of the really cool things about the plantar fascia. That's really cool. I'll try that again. That's one of the really cool things about the shockwave, is it actually helps to desensitize that innervation. So when you've got pain in an area for a while, one thing that we see is that there's a hypersensitivity to pain in that area. It's almost like the pain cycle sort of gets stuck on, and that's one of the most important immediate effects of shockwave therapy, is to break that cycle. And people often stand up and go, wow, my heel hasn't felt this good for ages. That's only a short-term effect, but it's really nice to have in the short term until we get that cellular response over the coming weeks. Which brings up the next question, I guess. How does the treatment plan usually work, Jeremy? Is this something we just do once, or would you do it a few times?
So typically, do it once a week, depending on the person. I usually start with maybe like 4 weeks in a row.
Yep. Once a week for 4 weeks?
Once a week, for 4 weeks. And depending on how the symptoms are, sometimes that's all that's needed, sometimes we need that 5th or 6th treatment.
Yeah.
And usually from there, we'll have a review, a couple of weeks after, just to see how they're going.
Yeah. With regards to the evidence behind this treatment, it's really well used now. When we got the machine probably 5 years ago, it wasn't experimental, but it was not many people were using them. But now a lot of clinics, particularly podiatrists, are using them because it's just perfect, particularly for the conditions we see. It can be used in other areas of the body, but we don't care about that because we're podiatrists.
Yep.
It's feet all day for us. So yeah. Okay, so if you're at home, you have heel pain, you've had it for weeks, probably more likely for months, and you're not having any relief and you want to get better, come and see us. Now, we're not saying we'll definitely use this machine straight away, but what we will do is develop a treatment plan based on what's wrong, why it's happened, and how it needs to be fixed. And everyone is different, but we've got all the tools and tricks to fix that problem. All right, this is nearly a 10-minute video, so if you've continued watching to the end, you really obviously have a sore foot, so you probably need to call us. But thanks for watching. Have a great day.
All right, see you guys.
Bye.